Our overall spending on healthcare, whilst it's being touted by the Liberals as being exorbitant and unmanageable, that's absolutely a lie. It's a furphy that they're throwing up to try and frighten the Australian public. This crisis has been generated by the Liberal Party. It's not a crisis of reality in funding Medicare, and if it is so, then why is the co-payment not being directed to better fund Medicare? We know that the best value for public sector money is to be put into primary health care. That's where patients who have chronic and complex healthcare needs, those who are the most needy, are able to go to their doctor when they need to go. They're able to secure other treatments, investigative treatments, those sorts of things, and to do it in that sector outside of the very expensive acute hospital section. We already hear from lots of GPs that they've already taken many phone calls from their patients who are frightened, saying, you know, when do I have to start paying the $7 co-payment? What will that mean to me? Will I be able to still get an appointment to come and see you? So there's an enormous fear factor that's been put into the community. People who can least afford to pay are being forced to make critical decisions about whether they access healthcare for themselves, for their partners, for their children, or do they choose to use that money some other way in their already limited budget. You've heard a number of people in the audience tonight tell you that they cannot afford in a fortnight. That's the difference between someone putting bread and milk on the table for their children or going to the doctor. These are the choices your government is forcing people into. Okay, I did get a lot of feedback, and it was very positive feedback, and it was very humbling actually, because there were people that I didn't even know who sent emails, or at the Medicare rally people came up to me as part of the crowd and spoke to me and thanked me for speaking and saying what they would have said had they had the opportunity. Medical and nursing leaders, health economists are all opposed to your co-payment. Look, I wasn't very satisfied with his response. I thought that it showed pretty much a dearth of insight into what is truly happening in the healthcare sector and what does go on day by day, what we as nurses and midwives see every day in our practice. I thought that it shows very little compassion for those people that are already in the health sector as consumers, and particularly those with chronic and complex healthcare needs, who will be in the system for a very long time. I think it points to an absolutely cruel irony that you would seek to charge those already with illness and disease to fund a future medical research fund. That's not how you fund medical research. That's absolutely really disgraceful, and it shows them to be, I believe anyway, ethically and compassionately bankrupt. There's no rationale behind it, and they will force us into an American style system where those who can afford to pay can access pretty much whatever they want to access, and those who can't afford to pay will be given very little access at all. You know, one only has to look to things like Michael Moore's fabulous documentary Sicko, which really spoke to many people, I think, about how destitute the American healthcare system is in many ways, and how the insurance company is able to manipulate what level of healthcare you're allowed to access. It's an attack on all sides on the public healthcare system, and I think privatisation it's part of their mantra. Let the market decide where things need to be, and that's a very poor outcome for the general public. Public healthcare needs to remain in public hands. It is absolutely immoral to try to seek to make money out of a healthcare system. The role of government is to provide a standard of care for every Australian. That's what Australians want, that's what we've got, and that's what we will fight for. And the Nurses and Midwives of Australia will hold this government to account.